the current system is imploding. The president has stated it. I understand it. The American people understand it. This system has failed. That's what the president's saying. And that's why he is demanding that Congress act. If we could fix it by regulation, we would do so. But it takes an act of Congress to take care of it, and that's what the president is demanding.
In the White House's view, they can't move on in the Senate. In the people's view, they should move on in the Senate. They should stay and work and figure out a way to solve this problem. Keep in mind, you're talking about something they've promised to do for 7 years. You can't promise folks you're going to do something for 7 years and then not do it.
Is that the president's plan? Stay on repeal and replace, change the Senate rules, end the legislative filibuster so that you can pass a fuller repeal and replace, including selling insurance across state lines?
The president will not accept those who have said it's, quote, time to move on. When he talks about the 51 votes, the president is basically making the case that so many of the components of real health care reform, Chris, require 60 votes. The drug pricing, the selling of insurance across state lines. So he will stick with it.
I've made very clear that I believe we would produce far better legislation if we went through the normal process of having committee hearings, hearing from healthcare providers, from insurance regulators, from advocacy group, from governors, from everyone involved, and then produce bipartisan legislation with input from both Democrats and Republicans. That's how we get the best legislation.
If the Republicans had gotten their way, there would have been another 30 or 32 million people thrown off of health insurance. That is crazy. What we should do is move in the direction of every other major country, guarantee health care to all people as a right, not a privilege.
I'm glad to see that now we're talking about sitting down with our colleagues, going back to committee, going back to what we call regular order, and letting the committees and the experts deal with it and bringing the public in more than we have before.
You can't take a bill as big as this one, write it with a select group of people in a back room, not let one of the political parties even see it until the Friday before a vote comes up, and think that this bill is going to pass.